Welcome to the next session of the program. And today's topic of discussion is very important and relevant. I think this is where the actual problem starts between us and the patient part. Today's topic of discussion is how do you go about managing and resolving complaints? So when I say complaints, it could be there's a complaint coming from the patient party that there is something that they want and they're not getting, or it could be a request that they want us to meet their need. So when such situations happen and if we are able to handle it in an effective manner, usually patients are happy and thankful, and they also go and appreciate that the staff in the hospital is very helpful, very forthcoming, very adjusting. But more often than that, I think we get to hear complaints and people are not satisfied with the way their request was dealt with. So I'm reminded of one incident that happened almost like, I think, 20 years ago, long, long ago. But then it's a very eye-opening kind of experience. So I thought I must share with all of you. So I know a gynecologist who is a very good friend of mine, and in her clinic they delivered a normal, healthy child. After the delivery, in a 2-3 days time, the mother was discharged, and then she came back for follow-up after another 2-3 days. So she had episiotomy, and when she came in, the doctor just talked to her, and then she asked the nurse to do the dressing. So that's what usually they say, sister, dressing kar do. So patient's husband was sitting, right there. He said, "Ma'am, aap kar dijiye." So probably he thought ki if she will do, she'll at least see the wound and she'll see if the sutures are healthy and everything is fine. She'll examine the site. But as usual, in a little rude, way, tone, she said, "अरे भैया ये sister की duty होती है, वही करेंगी." I think this is a very common way people talk. So she was, ड्रेसिंग भी क्या थी, वो बीटाडिन लगा के क्लीन करना था, और तो उन्होंने क्या करना था. But then they did it, and that person and that lady went away. Incidentally, that person was a small-time journalist. And he was really, very unhappy with the way the doctor had spoken to him. To the extent that he went to take kind of revenge with her and lodged a lot of anonymous complaints to every department that was related to her nursing home. So electricity, water supply, biomedical waste, building bylaw, everything, any house tax department, whatnot. I don't even remember the number of departments he wrote an anonymous complaint. And for next 4-5 years, she always, kept having somebody or the other coming from one or the other department with the file that there's a complaint against you and we are here to investigate. And usually when they come, you have to pay very hefty amount to get rid of them. In those days, I think she spent anything like 8 to 10 lakh rupees to close those issues. So a lot of time when we don't handle, situations very mindfully, we do end up in situations like the one I've shared. I'm sure it must be much more now, what I've discussed. It must be happening much more now. So what kind of complaints or requests do you get to receive from your patient party? Usually.
Admission request.
Admission
request.
Admission request. Please admit कर लीजिए, है ना? मेरे patient को admit कर लीजिए. Yes, that's a very common request we get from them. What about others?
Request or complaints, ma'am?
Both things. It could be request, it could be complaint.
Housekeeping?
Yeah, that's another common. Yeah, that's also very common, that they are not satisfied with the housekeeping services. Very true. Yeah. What do others say? Yes, Dr. Pradeep.
Ma'am, we are waiting for the report for so long. And
Yeah.
the doctor who is supposed to visit hasn't come till yet.
Yeah. Commonly, if the waiting time is too long or there's a delayed service or delayed report, they are very unhappy and they because they are desperate, they are waiting. So for them, even that short wait becomes very too long to tolerate. I agree with you completely. Uh, Michelle, would you like to add anything to the discussion?
Yeah, sometimes if ward rounds are late,
Yeah. If the doctor hasn't come,
or
you will
yeah,
find it
and
very
if there's not adequate amount of follow-up, so
absolutely.
and every time they come, they see a new doctor, so
Yeah.
that could
That,
also.
yeah. So usually about the services, about the medical attention, about the treatment, if there's a delay, they are usually, dissatisfied or they would kind of come and request initially, and then sometimes they become agitated and they also start arguing with us. And if we don't know how to handle those situations, in a professional and responsible manner, that is where the communication breakdown happens, and it can go to any extent, to the extent of patient party becoming aggressive or violent or calling police, or even physically they may assault the staff or people working there. So who should be given the training to resolve and attend to these complaints?
Who should be trained, ma'am?
Yeah.
All.
All of them, whoever deals with their department.
Absolutely. I think each one of us should know how to handle a complaint or a request, because if we do not know how to manage it, it can take us to any level. I'm reminded of another case. That's also a real life case I'm sharing with you. So there was this young boy who was on his way to distribute his sister's wedding card. His sister was getting married in very near future. So he was on his way to distribute her wedding card. And unfortunately, on the way, he meets with an accident and he dies on this. His body is brought to the hospital, and because it's a road traffic accident, so naturally they had to do postmortem for the disease. So family came in, everybody, tried to request the doctors that do away with the postmortem because it was road traffic case. Everything was okay, so it can't be, and there can't be any reason for him to be killed. But then doctor said it's not, possible. Then they requested, okay, at least do it today because, we need to really now think, what do we do? Do we go ahead with marriage or we call off the marriage for the time being or postpone it? So they kind of, tried persuading the doctors to do it on the same day. So since it was a small hospital and they didn't have a forensic department, within they had to call doctors from the other hospital. So they said, we can't do it today, it will be done tomorrow. So they went to the medical superintendent with the hope, because they will not know why we are postponing. They will think that we are postponing because we don't want to do it. They don't understand sometimes the processes that go behind the curtain. So they went to the medical superintendent with the same request. He said, please, there's a message from me to give me 1 second. Oh. Has she joined? Yeah. So they went to the medical superintendent with the same request that, sir, if at all you have to do the postmortem, get it done today so that we can take the body and cremate and then, move further and think what we have to do. You won't believe the reply that came from the medical superintendent's mouth was, I'll speak in Hindi, Maheshwari, then I'll explain you in English what it is. Because Hindi had, the way he said was very, very shocking for anyone. He said, मिट्टी है, चाहे आज करवा लो, चाहे कल करवा लो. In English, these are ashes. Whether you get it done today or tomorrow, it doesn't make a difference. So you can well imagine how the family must have reacted to this response coming from the medical superintendent. So that means each of us require training to handle situations where people come to us with some request or some complaint. And if we don't know how to handle it, people are going to go back dissatisfied. There can be violence, there can be aggressive reactions, there can be all sorts of things. And look into any situation that there is a violence or aggressive reaction. The root cause of that will be somewhere there was a communication failure, some misunderstanding, some dissatisfaction that was not addressed, and it escalated to this level. So I want to start this session with the role play. So I'm going to give you a situation, and I want two of you to be the patient's family. Because in our culture, it is never the patient. Patient is usually the nude spectator of the situation. And then I want one of you to play the role of the officer on duty. So you could be doctor on duty, or nurse in charge on duty, or patient care coordinator, whatever role you want to play, it doesn't make a difference. But you are the one who is handling the situation. So let me show you the case and then we take it further. I hope the screen is visible to all. Okay. So take a minute to read the case and then we discuss further. So should I stop sharing? I hope all of you have read. Okay. So who would like to be the patient's family? So make sure that each one of you plays some role so that you become used to doing role plays. Because when you will try training people, role play is one of the ways you will be using to train people. So you have to not only become comfortable in being the doctor or nurse or patient family member, but also how do you go about conducting a role play that also has to be learned. So who would be patient's attendant? Raise your hand, please. Any two members. Okay. Arshia. Shikha, I think last time you were patient's attendant.
Yes.
So Dr. Pradeep, this time you be patient's attendant. So both of you are son and daughter to patient. Arshia is daughter and you are son to the patient. Okay. So Maheshwari, you be the hospital administrator. Is that okay? I don't want to bother
The
Michelle.
person who handled,
Sorry.
the person who handled the patient, ma'am. I'm the
To
person.
handle the situation. They are coming to you. They have come to you that this is what has happened. This is what we have noticed. And we want you to, ask the nurse to come and apologize, or we are calling police and we are going to, report to the police and also call media. So, Michelle, I'm not asking you to, play any role at this moment. I think just listening and observing will be good. So, we'll all close the video and 3 minutes time is okay. 3 minutes time is okay. So assume that Maheshwari is in her office. She is an administrative officer. And Maheshwari, are you okay to play the role of administrative officer?
Yes, ma'am.
Because usually they would come complaining to somebody higher. And assume that both of them have come to your office. So I'm going to switch off my video. Shikha, I request you to also switch off your video. Yeah, go ahead.
Well,
Hello, ma'am. How are you?
ma'am, good afternoon. Please come in. Yes, ma'am.
Ma'am,
How much are you?
we faced a very serious problem. My relative who is there in the ward, he has been treated very badly. And how can the nurse behave like this? You know that the patient is very ill, and if the patient has not been able to control his bladder, then if the nurse behaves like this is not done. This is not something that we expect from a hospital of this repute. We have come here for good care. And if this is how the patient is going to be treated here, I'm sorry, we will need to call, report this and call the police and move out from here.
So I'm so sorry for the inconvenience which happened today, ma'am. May I please know which ward your relative belongs to? Which ward is she, and
So she's in one-to-one,
which she's in the
ward 1-to-1.
sorry, one? Okay, ma'am. Who was the nurse in charge for the ward, ma'am?
I think her name is.
We don't know. We don't actually. You have to inquire about that, ma'am. You
Yes,
have to
sir.
inquire. We are having a patient
Yes, sir. Yes, sir. I really
there, and it was not treated well.
Yes, sir. I agree with your
So
point, sir.
patient
But
was lying down in the urine and stools for the whole night. You people have to
yes, sir.
whoever taken the round supervise the patient. So how can we know what's the name of that supervisor or nurse?
Yes, sir. I'm so sorry for
We have to
that.
shift the patient and just call that fellow to come here to apologize to the patient and call him in person.
I'm so sorry, sir. Actually, we have different shift bases, so that's why I just asked you for the nurse's name. That's fine, sir. We will address this issue, and I'm so sorry about it. And I will really come to the ward and speak to the person who had attended your relative, sir. Please, I will come along with you. I can come there and sort out the issue for you, sir. So,
Hey, you need to do this.
And there was issues definitely.
I mean, this is not done. This is
Please.
not done. How can the patient be treated like that
One
in
minute,
a
1 minute,
hospital?
ma'am. I'll just check who was the guy who was attended in your ward. Okay, ma'am, this guy is a new person and he has been joined. He's a new joinee, and I'm so sorry for his behavior towards your patient, ma'am. And I will see through that he's been
That's not our fault. If he's a new joining, so you people have to train them. It's our first experience. Maybe, so that is not the excuse.
I really agree with you, sir, but he's been trained for that, and I will terminate him for his behavior, sir. So please take my apology as on behalf of our my hospital, and I will see through that your relative, the patient is treated well next time, sir.
Ma'am,
so
call him here. We want an apology right in front of us. Whether you terminate or not, that's your problem, but we want him to come and apologize to the patient also, because our patient is badly traumatized with the way he behaved. Please call him.
I'll call him. I'll call the nursing in charge and ask him to come here right away, ma'am. I'm so sorry for your making you stressed at this moment. And it's our responsibility to keep you stress free in our campus. I'm so sorry, sir. He'll come and apologize you right away now.
Thank you. Can I request everyone to come in?
Sorry for that.
Sorry, Maheshwari, for us being rude, because that's how patients would talk to us. Yeah. So I just want to ask one question to all of you. How okay it is to call the employee and make the employee ask for apology?
It is necessary, ma'am. I feel it's necessary. The patient is not happy or mishandled, maybe in a rude manner. Definitely, he owes an apology.
And what about the morale of your staff? Suppose if your staff was actually unwell and you made him or her do double duty for some reason, and because of fatigue, he or she kind of uh, did not behave well with the patient, and then you're asking your employee to apologize.
Maybe not immediately, but we can always ask the family members that we will come back to you. Along with the staff, first we have to inquire the whole situation. And if they don't give you time, but just request them to give us some time. And definitely we'll come back to you and resolve the issue. And if the staff is on the wrong side, then he will definitely ask for apologies.
But should we ask the staff to come and apologize in the presence of the patient party? And suppose if the
Yes.
patient party becomes aggressive, for example, if it was a female patient and it was a male nurse who touched the patient and the family feels it was an inappropriate touch. Now the family is asking for apology. You agree to ask the employee to come in front of the family. Now one of the family members becomes violent and they start hitting the staff. Then what?
We should de-escalate the situation.
Or else
We will avoid if that is the situation, then we'll avoid that staff to come to there. Otherwise, they will this situation will get aggravated. And but we if we are having a good rapport with that family, and we know that these one or two persons are sensible to whom we can talk, or with we can connect, then we will tell them we are sorry for that. We will take action, and we'll definitely remove that fellow from this place, and
So
we may
again,
go ahead in that
the,
direction.
like Maheshwari, you went to the extent of saying that I'll terminate that person. I mean, how far can we do that? And in case it was really a deliberate, error, or
He had handled the patient rudely. What if the patient's condition become worse? In that, if that's going to be the case, we have to definitely terminate him.
there can be an inquiry about it. There can be detailed investigation to find out what exactly happened. Maybe the patient was also acting aggressive. We know patients who are chronically ill, and especially if they are in hospital for a long time, there are patients who go into, hospital psychosis, and they become agitated and they start using abusive language against hospital staff or start hitting them. So, I mean, and we know, I mean, usually the staff will not know how to actually maintain distance and still remain professional and not give tit for tat and retaliate to their aggressive behavior. So, why I'm asking this question is that the shortcut is yes, I call my employee and ask them to apologize. But then, how far it is advisable? Because if, as an administrator, I'm just making my employee come in front and then they start arguing with each other and start fighting, then what am I going to do? Suppose my employee comes and says sorry, and the other one, the patient party, says something which is very aggressive or maybe uses some abusive language against my employee. Now my employee is very unhappy because he has been, abused by the patient's family. Now what it turns into a aggressive, action and reaction from both sides. So bringing both the parties, to one place is not a very, a good idea. One should actually avoid such situations. One should actually avoid such situation. So what I would say, let's do the same role play once again. But Dr. Pradeep and Ashya, be more aggressive because your patient has been hurt. One of my staff has mishandled your family member, your father. You're very unhappy. You're paying for a service. I mean, that aggression should come in your So the learning that we want to have from here is how to, like Dr. Pradeep said, de-escalate. Of course, Maheshwari did wonderful, actions when she was listening very attentively. She was allowing you to speak and express yourself. Then she even apologized. Right in the beginning, she said, I'm so sorry for what your patient had to go through. But after that, when the patient party said, or rather I provoked, when I said, call the patient, call your nurse and ask the nurse to apologize. Or when Dr. Pradeep said that we want the nurse to come and apologize, and you said, I'll call and then I will terminate. And also sometimes when we give excuses that this staff is new, or this staff is untrained, or this staff is, we are short of staff. These are excuses the family will not take. They say, we are paying you for this service. Are you charging me 50% because you're short of staff? So we have to be careful when we give the reason or when we try to talk to them. So let's have a quick role play. Just because I thought I feel after the role play, if you get a more clarity on how we have handled difficult conversation, it will leave us more. It will give us clarity on how to handle. So Arshia and Dr.
Can
Pradeep,
anyone else do my role play? I'm not in the right set of mind to do it.
Shikha, okay, no problem. I think Shikha can do that because I know last time also she acted. But Shikha, continuously, if you will speak, I will not be able to demonstrate how we have to handle it. You be aggressive, that's your right. But then you will have to let whatever I want to demonstrate, that has to be demonstrated. Is that okay? So let Shikha and Dr. Pradeep be the patient's family, and I be the
I have
administrator.
a question.
Sure.
When we had a role play,
Hmm.
Ashia was like, she didn't let me answer, and she immediately came to a conclusion that I'm going to call the police. But
Hmm.
usually, this kind of arguments will never, I mean, calling police will not be the initial time of complaint. After so many exchange of argument, after explaining so many times,
We will
maybe
try to answer.
happy they will go for that statement. So that
That's
kind of
But again, Maheshwari, we have no control on the patient party's behavior.
okay,
We
ma'am.
have no control because there can be a patient party who is just bent upon calling police because they want to create a scene, or they know somebody in ministry. They have already called, or they know an MLA in your area. They've already called the MLA. These people are misbehaving, mishandling my father. Come here and see how. So anything is possible. So even if Arshia started with this, that if you don't ask the person to come and apologize, I'm going to call police. Maybe she's already very frustrated with the whole thing, and there's already a pent up anger for other things which has brought her to a point where she says, I'm going to call police. There's a possibility. Yeah. Okay. So I request everyone to switch off your videos. So usually we believe that when something like this happens, you would already have some information, internal information from your this thing. But I'm assuming I don't have any information from my department. So I'm just taking as you are coming into me. So hello, good morning. Please come in.
Good morning, ma'am.
Good morning.
A small complaint that has happened with our patient.
Mhm.
And our patient is admitted in ICU. He is.
Can I request you to introduce yourself and also tell which patient you're talking about? Because I haven't met you earlier, so I need to know. Please, yeah.
Our patient name is Mr. Rakesh.
Mhm.
He is admitted in ICU.
Mhm.
The past 2 days he is admitted here, and this morning we find one very serious issue. We didn't get involved there at that moment, but we wanted to escalate these things to somebody who can do something for us and to our patient.
Can you tell me in detail what exactly happened?
Yeah, he's my.
Ma'am, we have to shift the patient. Ma'am, please. We have to shift the patient.
Brother, let's discuss the situation
We
first.
don't want the patient to be here. He was manhandled very badly.
So
Let's
how are you
discuss the
related?
situation.
Ma'am, the patient was in ICU.
Uh-huh. So how are you related to patient? I need to know you so that I can talk, converse with
Patient
you.
was in ICU, Rakesh Sharma,
Okay,
and there was one staff
okay.
patient was lying in with urine and stools throughout the night, and
Oh,
patient has told the staff, and we people when went there to meet him, there was very foul smelling. We also complained, but nobody helped the patient, and rather they were rude. So we have to ship the patient, ma'am.
right. I'm extremely sorry for what has happened. I think that's very unfortunate that the patient actually was lying in urine and stool, like the way you are mentioning. So you are related to the patient. Your good name, please. I want to know your good name. You are
He's my elder brother.
okay.
I'm his son.
He's
Okay.
Dr. Pradeep, and I'm Shikha.
Okay.
We are a son and daughter of the patient.
Oh, you are both his children, patients. I'm
Yes.
extremely sorry. I know it must be really very disturbing and upsetting. I mean, seeing your father lying in urine and so nobody attended to your patient. Was it was that the
Staff
reason?
was there.
Mhm.
Staff was there, but the way he is attending our father is not good. We didn't
Oh,
interrupt at that moment, and
okay.
very frankly, we are very scared about all these things. That what will happen later.
I
So we didn't
I
interrupt at that moment, and we wanted to escalate to you only.
Thank you so much. Thank you that you came to me. I am administrative officer here, so I look into these, difficulties and challenges that the patients and the families experience. And if you give me a little time, let me talk to the staff and understand what exactly happened. Of course, I've heard your side of the details, and I completely empathize with you. But let me understand from my staff, and then I discuss with you. Is that okay for 10 minutes? If I
You
can
can
talk to my
ask the father also. He is in a situation to
absolutely.
experience all these things.
Absolutely. I will do that if need be, but I think let me not bother him. You have already shared all the details with me. Let me speak to my staff and come back to you in 10 minutes. Is that okay?
Yes, we can give you a
If it is okay, can you sit in the waiting area and I'll call you in 10 minutes time?
Sure, sure. What you
Thank
say, Bhai? Should we give 10 minutes?
But we want a apology from that fellow.
Definitely. Let me first see what exactly has happened.
We don't want this thing happen again.
Give me 10 minutes if that's okay with you. Is that okay? Okay. Thank you. So assume that we have come back. I have found out that exactly the nurse had actually mishandled your father while changing the clothes. So I have called you back. You are in the room again with me. So Mr. Pradeep and Shikha, I found out from the staff on duty there, and what you said was absolutely right. I mean, the nurse who was attending to your father was actually not very respectful to your father, and I completely understand your how disturbing it must be for you, and I sincerely apologize on his behalf. And I'll make sure that we go into the detail and find out why that happened, because ultimately there must be some reason which I need to find out. So, is that okay if I find out what exactly happened, like on his side? But I'll make sure that your father is looked after well, and his all his needs are attended promptly. Is that
We
okay?
wanted to change this staff now because we are very much scared.
I'll make sure that I mean, my more responsible and experienced staff looks after your dad.
We are very much scared about all these things,
Yeah.
and we don't know whether other staff will do the same or not.
I know it's a very unfortunate incident, but but this is not something that happens regularly here. I'll definitely find out the reason and I'll do the corrective action, what needs to be done. But at the same time, I'll put more responsible staff to your father's care, and I'll personally see that. I mean, he's looked after well.
Do you think, Bhai, that we need a written apology?
No, if they
Yes,
will change the staff and some senior staff will take care of him.
definitely, definitely. I'll make sure that I'll speak to the
But
staff.
some action has to be taken against him.
Absolutely. So you were asking for apology, and see, I can ask him to come and apologize. But usually when we make people do like this, it demoralizes them. Because at times there could be some reason, I don't know, I need to find out what could be the reason, but that does not give him the excuse to misbehave with the patient. But if I will ask the staff members to come and apologize to you, rather than doing any good to the patient or to us, it will harm us. So it's better if we, and as it is, I think your father is recovering well and you are satisfied with the doctor's treatment who's attending to your father. And will focus on his care and treatment. And I'll make sure that I have right people looking after your father, if that's okay with you.
I think it's fine.
Thank you. Thank you. So can I request everyone to come in? So what did you see in the role play? What did you observe?
The patient attenders were not that aggressive on the what happened, ma'am. They were like okay with your explanation. I think they were not very keen about the staff who had mishandled. They are like, okay, it's fine.
Absolutely. So I mean, whether it was because it was me who was playing the role, or it was because the the way I was behaving, it could be both ways. But I agree that they were not that aggressive the way I expected them to be, and normally they are very, very aggressive. But usually when they ask for an apology, a personal apology, so usually I tell them that that it is not helpful to get apology in person, because I don't want to demoralize my staff. It's my duty to train them and empower them with the right skill, which I will definitely do. I'll get them retrained. I'll conduct some more. I'll get some more sessions done for them on their respectful behavior or cordial behavior. But then asking them to come and apologize will not help us. So that explanation normally goes well with the patient party. They understand that we want best in the best interest of our patient. That's what. What else? I think I saw a message from Neetu, and what has she written? Comfort from your side, ma'am, on patient condition. Yeah. So I think I did apologize number of times, and I also said I can understand that it must be very. So if you can remember those 5 skills which I started in the second session, and if you can bring them here, you can handle any situation. So please remember those 5 skills. I built my rapport with both of them. I was meeting them for the first time. If I was the doctor on duty, I would have already known them. Then I would have said, आइए शिखा, आप राकेश जी की बेटी है ना, और आपके साथ कौन है? I would have started this way. But since I'm an administrative officer, so maybe I have not met both of you, but I made sure that I built rapport with both of you. I took your introduction, then I introduced myself, how I am going to get help or what I am going to do. Then second was I listened to your problem. I made you talk about your problem, because that helps ventilate emotions, that help ventilate the concerns the person has, and that gives you more clarity on what they are thinking and what they are feeling and what they are looking at. Because a lot of time their problem could be उनके कपड़े बदले लेकिन screen नहीं use करी उन्होंने. So for them that's such a big issue that my father was literally naked, when they were changing his clothes. Staff did not realize that even if he is 75 or 80 years old, nobody likes to be, lying naked on a bed without screen or guard. So you have to see what they are seeing in this situation. Then third was positive and helpful attitude. I came up with ideas that I'll make sure that more responsible staff looks after your father so that he's treated with respect. And then empathy, I think number of times I tried to communicate empathy. And then I asserted. I did not quickly bow down to agreeing to call the staff to come and apologize or to chuck that person out. I asserted saying that, it wouldn't be fair to call. I gave reason. which worked for me. But I did not agree to call the staff and apologize because I know it can have serious consequences. So that kind of, unless it is just not going to work, then of course you have to, you know, accept that. But it should be rare of the rarest situation, not a regular. What else did you observe? Anybody else who would like to?
Ma'am, I particularly like the fact that you asked them for time, right?
Yeah.
That you asked them to just give me 10 minutes for me to go back and kind of get the actual situation from my staff side. Luckily, they agreed. So it was favorable. So I think it kind of de-escalated even that heated whatever tension
It
that they were
broke the continuity.
continuing to. Yeah,
But if they don't agree again, you have to assert. If they
correct.
said, no, no, you have to call. Don't you
Mm,
trust us? I'm telling you, is it not?
correct.
I trust you. I completely believe you. But then I need to understand what exactly happened. I mean, my staff usually is very well behaved. I'm sure there must be something that I need to do. But definitely, I understand your concern. And nobody would like their father or any family member to be ill treated like this. It is unpardonable. So I need to find out. So again, you will assert because you need time to go back to your team and find out maybe the patient is in psychosis. So I need to then counsel the family that I know you were upset, but did you observe that for the last 10, 12 hours, the patient is little disturbed and is aggressive in behavior. So usually when the patient is in hospital for a long time, they tend to become aggressive and they act abusive and also violent sometimes. So although the staff is trained to handle such situation, but then at times it comes as a reaction, which is not acceptable. But I mean that could be the reason why the staff was little, or they were holding the patient's hand tight. Even that could be one complaint coming from the patient's family. इतना कस के पकड़ा हुआ था, हाथ में निशान ही बन गया. So there will be different situations you will have to handle in a different manner. That's the whole idea. What do others say?
Ma'am, one question.
Sure,
Can I ask? Yeah.
sure.
Ma'am, suppose there was any medication error or something wrong with the patient that hurt him, and patient attendants wanted, they just want to shift the patient. They were not listening to us in those situations. No, we will take this patient to other hospital. So at that time, how
Yeah. So
we will
one is
communicate to them?
you will have to accept that yes, there has been an error. Now, what I'm going to do, I'm going to shift the focus on the patient's care and welfare. I completely understand that there has been an error on our side. But at this moment, rather than shifting the patient to another hospital, I would like to make all efforts to undo whatever harm has been done to the patient. We can attend to the patient. We have all the team members, we have experts around us who will be able to administer drugs to minimize the damage caused by the drug. By shifting the patient from here, we will not be doing any good to the patient. I am with you on this. Let me first try to see how we can, make the patient feel better and manage the patient and minimize the damage. After that, you can take a call. If you want to take, if you're not satisfied with our service, I'll not force you to stay here. But at this moment, I think our focus should be to save the patient. I hope you will understand. Show
Thank you.
them how are they going to be benefited by cooperating. And if you shift their focus to the patient's welfare, they tend to read your intentions that you are wanting to, to save the patient or to ensure patient safety. And then you're giving them the option. If they want to go, I'll cooperate with you. I will not stop you because if you're not satisfied with my service, I can't force you to stay. But then at this moment, I think the patient's safety is most important, and we need to make every effort to save. Does that answer your question?
Yes, ma'am.
Is there, thank you. Is there some network problem at my end?
Yes, ma'am.
Oh my goodness. Okay. Sorry. Any other question or comment or feedback? Shikha, if you wish to give, or Arshia, if you wish to give, or Michelle, anybody?
I think the one thing that you said was that give me 10 minutes and I'll come back to you. So, the time also that you said 10 minutes
Yeah.
was optimum. It was, sometimes, they'll say, "Oh, okay, I will get back to you," or give me 1 hour and I'll get back to you, or something like that. So I think, it's that there's an immediate action that is happening
Yeah.
in response to our complaint, and then, we will be responded at the same, early on itself. I have one question, as in,
I want to add to the previous point and then to answer to your question. I even offered them to wait in the waiting area. I didn't say please go out and wait. I'll call you back. I said we have a waiting area. I see we have to treat them like equals. We have to ensure their comfort, convenience. And when you do this, they feel respected. They feel that we have been given a fair treatment, then they also tend to be fair to you. So courtesy starts from us. Good behavior starts from us. And it comes as a reciprocation. Yeah, now you can ask your question. Go ahead.
my question is, because I am not into, I don't work with hospitals. I just want to understand, does this happen very, very often in hospitals? As in, that patients get very aggressive. There's a lot of, and if we take, on a scale of 1 to 5, as in, how many cases per day can one expect such cases per day in a hospital? Does that happen?
Again, depends on the size of the hospital. For example, and also which hospital is, for example, if it's a government hospital, there is more likelihood of aggressive reaction and complaints because we are short of staff, we are short of resources. People are not very responsible. In a corporate sector, we are charging them, they are paying. So we are proactive in providing services and we are well behaved also. In corporate hospital, mostly the staff is usually very well behaved. The problem people face or the management faces with the doctors, that also senior doctors. Junior doctors are also well behaved because they know that they can't afford to misbehave. But in a government sector, everybody misbehaves, right from doctor to the PN and parking person and anybody and everybody, pharmacist, radiographer, anybody can misbehave. Shikha can agree and disagree with me. What do you say, Shikha? She's in government hospitals, so she knows that
100%.
here everybody is a boss. Everybody
Yes.
is, so they don't care because they know their job is secure.
Ma'am, I wanted to share one thing, ma'am. In
Sure.
my hospital, which happened 2 days back,
Mhm.
there was a patient who was waiting for in pharmacy, waiting for his drugs to get dispensed. My staff is a left-hander, so he was like dispensing his drugs and his prescription. He got the money in his left hand. My patient attender told him that why do you get money in your left hand? It's like not auspicious for us. Get it from your right hand. And he had answered to that attender that like, see, I am a left-hander. I do all my job in my left hand. What if I get in left hand? What is your problem? He has argued with that attender. And what is your problem? And then he started saying, instead of talking, you finish my dispensing quickly. Why are you talking? I mean, it kind of an argument has gone in between them, ma'am, and the patient was so aggressive. He became so angry and he called him da. I mean, he said, give the medicine, give quickly, like that and all. In this case, do I have to advise my staff or like, I really
They have to be trained to talk to the point. If I'm using left hand, I can say, I'm sorry, but I normally use my left hand. So therefore, I'm taking money. But I understand your concern. Okay, if you want to give me in my right hand, give me in my right hand. Finished. Not all 100 patients will insist on, exchanging money with right hand. If there's one person who is insisting on it, oh, you feel bad. Okay, I'll use my right hand. Normally, I use my left hand, so I'm in habit of doing that. Pardon me for that. Okay. So, see, we have to learn to mitigate this situation at the the lowest point. And we have to respond, not react. This is one thing we have to learn. Delay your reaction by 90 seconds and it becomes response. Think and respond. And you will not go wrong on your reaction. But normally what happens, people are mindlessly reacting. And this is actually, see, it's somebody's belief that if you are exchanging money with left hand, it's not auspicious. I can't change that belief. It's a deep down in the schemata of the person.
Yeah, when I spoke to that staff, he told me, ma'am, everybody are teasing me for using left hand in the department. He told me, ma'am, everybody are telling, why are you using left hand for this? Why are you doing this? So it was like accumulated anger. He just,
Yeah, exactly. But here you could say people who use left hand, they are very intelligent. Their right brain is, more active. So you are lucky that you are using your left hand. And that way you can boost his morale also. As an administrator, you have to be very smart. You have to be 10 steps ahead of them. Only then you can, create good environment in your place. But if you yourself are tense or upset or aggressive, then you're going to create more chaos than doing good to the staff. Yeah. So any more questions on this?
Ma'am, I had one about if they are from obviously not very educated backgrounds, would this situation get harder to handle in the sense explaining it even from a process or medical point of view, or
See, if your verbal communication is respectful, if you're well-behaved, courteous, your tone of voice is not intimidating, rude, aggressive, authoritative, and your body language communicates that you are listening to them. You are helpful. You're understanding. So if you saw my facial expression and the way I was nodding,
Mm.
it did communicate that I can feel their pain when their father is mishandled by my staff, or when their father was lying in urine and stool for some time. And I didn't try to give the excuse that there are so many patients, the staffs are running here and there. What happened if your father was lying in stool? So what? So it is non-verbal communication that plays a very big role in winning your patient's trust. That's your tone of voice and your body language. So even uneducated people understand that language of respect and courtesy. But of course, one has to be really good at language.
Mm.
If it is an uneducated person and suppose elderly to me, then if I'm little more respectful and saying कि बाबा जी मैं आपकी पूरी बात समझ रही हूँ, आपकी तकलीफ मुझे समझ आ रही है, बहुत बुरा मुझे खुद बुरा लग रहा है कि आपके साथ ऐसा हुआ, लेकिन और मैं इसके ऊपर जरूर काम करूंगी और मेरे स्टाफ के साथ मैं उनको ट्रेन करूंगी कि हम किसी भी पेशेंट के साथ ऐसे व्यवहार नहीं कर सकते, ये गलत है। और मैं उनके बिहाफ पर मैं आपसे माफी मांगू, क्या आप मुझे माफ नहीं करेंगे? एक मौका नहीं देंगे कि मैं अपने स्टाफ को और अच्छी ट्रेनिंग देकर उन्हें समझाऊं कि हम पेशेंट के साथ ऐसे बात नहीं। अगेन the tone of voice, the way I'm speaking, the body language, it's more like dialogue.
Yeah,
So,
because
ma'am,
I'm
sorry, you go on.
yeah, no, so I brought this up primarily because in my settings it's mostly with death, right? So when the death happens and if they've obviously not really accepted, sometimes the emotions run quite strong. Like we've had experiences where the family members try to resuscitate the patient. They've pushed staff and not let the person pass away. So post that, like almost maybe 10-20 minutes later, they come back, to apologize that they've done it in a thing, but it doesn't happen all the time. We have had kind of like a mob, people coming, running
So
in.
see, we have to remember whenever there's a serious loss like death,
Mm-hmm.
the human cognitive process is
Correct.
completely
Shut down.
shut
Yeah.
down. So the people can behave in a very, very even educated people, well-being
Correct.
people. But we need to, first of all, prepare them for something like this beforehand,
Right.
so that it doesn't come as a shock to them. And then also in that situation, we have to be more understanding. So this example that you are talking about, in a similar situation in a government hospital, a young boy, he was playing with he was flying a kite, and unfortunately he touched a cooler which had live wire and he got electrocuted. Young boy, 14, 15 years old. So he was brought to the hospital emergency, and it was actually a broad death case. But then the protocol is that we normally try to resuscitate and then see if whatever can be done should be done, and then it gives the family also a bit of time to get clarity on what is going to be the outcome. So they did everything, they tried, and then they ultimately said that sorry, we couldn't save the boy. I mean, already the boy was dead, but then we tried to resuscitate, but it didn't work. Family accepted, and they went out. So when they went out, the dead body was still there. They went out, and somebody outside told them that was an uneducated community I'm talking about. So somebody told them, go and request them to do resuscitation once again. A lot of time the patient, comes back after some time also. Now the family comes in, parents come in. तब सर एक बारी और करके देखिए, आप एक बारी दोबारा ट्राई करो, शायद अच्छे. What was the response of the doctors? भैया डॉक्टर हम है कि आप हो, कर लो, खुद कर लो. अब इसके बाद क्या हुआ होगा आप सोच सकते. In those moments, understanding that a family has lost a boy all of a sudden, he was not sick, he was not, he was hale, hearty, playing. So imagine the plight of the family. Instead of this, if he had said कि आपसे ज्यादा मैं चाहूंगा कि मैं आपके बच्चे को बचा, आप कहते हैं मैं दोबारा भी करने के लिए तैयार हूँ, लेकिन कुछ नहीं बचा. हमने पूरा 20 मिनट नॉर्मली हम करते हैं, हमने आधा घंटा कोशिश करी कि शायद कोई मिरेकल हो जाए. आप कहेंगे मैं दोबारा भी करने के लिए तैयार हूँ. इन केस इफ द फैमिली इज इंसिस्टिंग और मुझे दोबारा भी करना पड़ गया, क्या पहाड़ टूट जाएगा? If you can avert a serious situation like mob attack by just doing 10 minutes of resuscitation once again, क्या हो जाएगा? So this is the sensibility we need to have to see the seriousness of the situation and how we respond to that. Isn't it? Okay, I think good discussion around the topic. So the whole idea is it could be a very small situation, it could be a very big situation, but we need to remember how we handle those situations will decide the outcome of the situation. So what are the common reasons that people come complaining? What are the common reasons? You can write in the chat box. I think that will give us more answer. Write in the
Delay discharge summaries, ma'am.
delay.
Discharge
Delay. Oh yes, that's a very common reason. For whenever there is a delay in discharge, they're very unhappy. They're very unhappy. What else? If you want to unmute and speak, even that's okay. But I want more people to think and answer. You can unmute. Lot of waiting time. Yeah. Yes, Arshia, very right. Waiting time is usually a common problem. Okay. Michelle says when symptoms are not improving after 24 to 48 hours. Yes, they are going to be concerned. Absolutely. Doctor's round is not on time. That's also a common reason. Then Arshia has mentioned a lot of waiting time. And then Ritu says consultant non-available on Sunday. Absolutely. So when there is no doctor, they feel there is no treatment. And they fear that things can go wrong. So broadly, actually, the kind of complaints patient give us can be categorized into 6 categories. The first one, common one, is staff behavior and attitude. That's one of the commonest reasons. Staff behavior, yeah, asking more number of visitors. So rather than that, when we ask the visitors to go out and they start arguing with us, that also becomes a problem. Usually, if they ask for more visitors, and if we are able to explain them that it's not advisable to have more visitors, I think we are able to manage and control. Isn't it, Shiva?
Usually we have the policy of less number of visitors because
Yeah.
more and more people will take ruckus. So especially in ICUs and special wards. So if they ask more a number of patient number of times, like हमारे चाचा अभी आए हैं, हमारा भाई अभी आया है, let them allow. या बच्चा कोई आ गया. But at that moment a conflict comes कि भाई नहीं आपने उनको भेजा था हमारे लिए क्यों नहीं? Other patients, family members will also come.
Yeah. So, Shikha, for ICU specifically, in critical care areas, I normally advise people that please assess the situation. If the patient is in serious condition and survival is unlikely, be more accommodative to patient's family. Please remember, these could be just last few hours when the family can see their patient alive. So we need to be more understanding and humane. But at this
last
time,
moment, yes.
yeah, but at the same time, it should be only the immediate family members who should be allowed with proper instructions that you are not going to stay more than a minute or so, and you're not going to touch anything. Just go in and come out. But then, because sometimes when we become too rigid with them and we say, no, you have to come only in visiting hours, and before the next visiting hours, the patient dies, then how will you justify your rules? Of course, with the other patients, those who are just visiting ICU for silly reason, there you can definitely assert that, see, there are patients who can get infected, even your patient can get infected. You can get infection from the ICU. There are patients who can infect you. So that's why we have the policy of not letting. So that is where you will have to assert. In that situation, you have to be firm. But in the previous one, where you know the patient condition is serious and patient may not make to the next visiting hour, and it is the immediate family member, maybe it's son or a daughter or some close relative who has come from a far off place and has not seen the patient at all. There we have to train our staff to be more accommodating, understand. So we have to learn to discern between the two situations. So I said there are commonly 6 areas, reasons why patient party, come complaining. The first one is about the staff behavior and attitude. So whenever anybody behaves rudely or is disrespectful or unprofessional or patient's concern has not been addressed, they are likely to come and complain. A lot of time they feel discriminated because of their age or race or ethnicity, gender. Again, that can be a reason they feel that the staff has not behaved well. The second reason why they are, why they normally come complaining is timeliness of care. Whenever there's a delay, like for example, you said the doctor hasn't come, the report has not come, or the OPD, there are long waiting hours, or there is lack of coordination of care, especially, for example, for discharge planning and execution is taking longer than usual. The family or the patient has not been informed that it will take 4 to 5 hours to get the discharge summary and everything, in place. So they are likely to be unhappy and they're going to come and complain. The third common reason is, bill is another reason. Absolutely. Especially if you have not done good counseling for the bill. There will be a dispute over it. Absolutely. Then third is communication and information. When we are not updating them regularly, when we are not answering their concerns, when we are not addressing their queries, when we are not meeting them on regular intervals, naturally they are at loss of information. They have no idea whether the patient is improving or not, whether the treatment is working or not, whether the patient is likely to make or not. So naturally all that becomes, all confusion for them. And usually they assume things are not going in the right direction. Even when you're explaining in a hurried manner, or you're using technical jargon, or you're not explaining them in a manner that they understand, there will be misinformation, there will be a lot of confusion. That also can be a reason for them complaining. The fourth common reason for complaint is patient safety and environment. Whenever you see the patient is likely to be, likely to be harmed because of the hospital facilities on infrastructure, people would come complaining. For example, there's a patient fall, or the toilets are not, kind of disabled friendly. So there's a risk of fall, or there's a difficulty in using these services, or cleanliness is an issue. Bed sheet is not clean, like housekeeping and everything. So they will come complain. The fifth reason why they would come complaining is billing and financial issues. When there is a discrepancy, when they feel they have been inaccurately or excessively charged, or when there is lack of transparency in billing, they are likely to, come and complain that they are not happy with the way the whole bill has been generated. So initial financial counseling, time to time updating them, answering their questions, explaining to them can help us, address their concern. But then all of a sudden, if you give them a long bill and then you have no explanation to that, they go to the billing counter, they say, go and ask your doctor. They go to the doctor, doctor says, I don't know, ask the nurse. They go to the nurse, nurse says, I don't know, go to the billing section. So we are making the patient run from place to place. If you have proper financial counselor or the treatment counselor, they will be able to explain what this bill is and why they are charged. That can actually look after a lot of stuff. Then one of the common reasons they complain is about the medical care, especially when the diagnosis is not clear to them, or patient has been misdiagnosed, or there's a delay in diagnosis, or the test reports have not been explained to them. You got a MRI done, or a CT scan done, or a PET-CT done, but nobody is explaining to them the outcome, the interpretation. They feel, what is this? You have got the test done, but you are not explaining it. So usually there will be a complaint about it that we are not, we haven't been given a clue. Now my question to you is, should we encourage complaints? Should we encourage complaints?
Yes. It gives us opportunity to improve ourselves and our process and system. So
Absolutely.
rather we must encourage this, and rather we must encourage our employee also, if they will tell what are the deficiencies.
Absolutely. So there has to be a shift in our attitude, perspective shift. We normally don't like complaints. We don't like receiving complaints. But complaints is the second chance to repair the damage. Suppose if we were doing something wrong, if the patient party brings it to our awareness, we can make that correction. Also, when you resolve the complaint, it earns their loyalty. They're happy and they will come back to you. When you ignore their complaint, they are likely to go and damage your reputation. They will go to Google and write poor reviews for you. Or they may tell others, don't go there, this is how they behave. So if you handle complaints promptly, address their concern, and see that complaint does not happen again. For example, there's something that's going wrong, and if you make a corrective action, CAPA, that we normally say, corrective action and preventive action. So naturally, the number of complaints of the same area will start going down. So automatically, it will also increase confidence of your staff. That okay, if a patient comes complaining, management resolves the complaint and also make sure that we rectify the root cause of the complaint, so that, for example, there's a regular complaint for dirty laundry, and I'm just getting the sheet replaced, but I'm not taking a preventive action by checking what is wrong with laundry. Or maybe the person with whom I have signed the contract is not doing a good job. Do I need to change the contractor, or should I speak to the contractor and explain that I'm getting these many complaints every day for the dirty laundry, so you have to take a corrective action. So that is how your staff also gets to realize that you are proactive in doing corrective action and preventive action. But if you just listen to the complaint and don't resolve it, amicably, they feel chalta hai wala attitude. So their confidence in themselves and their services also improve. That will also cause dissatisfaction. And then if the complaints are attended suitably, automatically they'll send you more patients because they feel that, oh, they listen to you, they address your concerns. Now, if you leave the complaints unresolved, what is the impact? How does that affect? What all can happen if you don't resolve the complaint?
Patients trust. We lose patients trust.
It can trust will be lost. Absolutely. What else?
I think everyone has a different way of thinking. Like if we talk about corporates, they think that there is a process of complaints. They do take complaints, but they make their feedback form or the suggestion boxes like that they will not get anything negative. And the patient side thinks that we write everything and that all the things go into the dustbin. Why? Because nobody is there to, like you said, kappa. Before kappa, we do RCA, root cause analysis. But for the patient side, they think that everything goes in dustbin and no one will come back to us and write to us or talk to us or have a call to us that, see, this is the problem and we have resolved in such a situation. And next time we'll do it. We make it sure that this will not happen to you or to your family member or anyone in the hospital. But here there is a big gap. In the government setup, we do
Again, Shikha,
find.
it will differ from place to place. That's perfectly all right. But
And why I'm
individually,
saying,
the call that we have to take is how do I want to handle complaints?
ma'am, why I'm sharing this experience of mine in as I've worked with corporate hospital, I worked with autonomous body, I worked with government setup. Everywhere the same situation happens, and everyone is like, okay, we got a complaint, cool down, no need to reply. And if major happens, then we just ask one of the staff to write the explanation, not with the in charge, but with the staff who is very junior, and we just sign, okay, noted, done.
Corrective action taken. So, Shika, again, I agree with you, that's the system. But somebody will have to take initiative in changing the system. First of all, there has to be a change in the attitude. If I believe complaints are bad, I will never like complaints. But if I start believing that complaints is a wonderful opportunity to know what I need to do to make things better. And society never changes all of a sudden. But if people at the top, when I say top, it doesn't mean the people in the management and talking, but when few people change, it brings change in this society. The change trickles down. So even if handful people start changing in the way they handle complaints, slowly it will trickle down to the lowest level. So assume that you are one of the top people who are going to bring change. This culture will get, percolated to every level. That's the responsibility we all have.
That's why I, as an administrator, I adopted one statement. Whenever I receive any complaint with any family member or patient himself or herself, see, we are taking these complaints not as a complaint, but as an opportunity to improve our hospital reputation. Because whatever you say, it will goes in the same way outside.
Absolutely.
So
That you're taking that initiative and you're trying to, bring a change in the culture of your hospital. That's very nice. Absolutely. So my next question is, what do complainant party actually want? What do you think when they come complaining, what do they want? Everybody, please contribute.
want somebody to listen.
Wonderful. I think that's one thing they want. They want to be heard. Absolutely. What
They want
else?
empathy.
They want empathy. Somebody to understand their point of view. Absolutely.
I think also justice,
Yes, they look for justice and action
fairness. Yeah.
taken to correct the problem. And wonderful. Then,
I think they also, I've had a incident with my own self,
mhm,
which was more of a malpractice where, I was given a wrong dental implant instead of the actual implant that I had gone for. So it compromised on the quality and also the pricing for that particular thing. And I wanted empathy, I wanted understanding, I wanted justice. And I also wanted that this does not happen to anybody again.
Absolutely. Absolutely.
So I think that's
So
also
some corrective action also. Somebody should take a corrective action. They must replace the product that they have, implanted and put the right one and bear the cost because I have already paid you for the service or the product. So I am not responsible to pay you again for that. So somebody has to take the responsibility. Absolutely. Meetu has mentioned respect and clear communication with the right condition. I think that's an important thing. They want to be heard and to be treated with respect. A lot of time a person who comes complaining to us, we are disrespectful. We are not verbally disrespectful, but it comes on our facial expression. Hey, why are you complaining? You're making a big issue of a small thing. That's what we normally think. So I think they want to be heard respectfully, to be given at least that opportunity to explain what they are going through or what they have experienced. They also ask for apology. Very often, just an apology also when we offer, they are okay with that. Of course, many of them even ask for compensation. If actually some harm has happened, the patient, they can ask you for compensation, but you'll have to pay me. A lot of time they ask the person who is responsible for something that has happened, that person should be reprimanded or punished, like apology or termination or something, and then assurance that this will not happen. These are usually the things that they ask for. She has written, I think what is also important is that there's a kappa and change in processes so that it does not happen again with any. Absolutely. That's what they are looking for. What corrective action will you take? And what preventive action will you take that it does not happen again? They want. So we have to be proactive in seeing what we can, suggest or what we can come up with that. Yes, like I said, I will definitely get my staff, retrained. That this incident lets me know that I need my staff to be trained once again about respectful nursing here and make sure that they are retrained on the same virtues. So that's a kappa that you are. So situations will be similar, but how we respond to the situation will depend on what is my style of handling conflict. So I gave you that questionnaire on conflict resolution style. How many of you have taken that questionnaire? Maheshwari, Michelle, Dr. Pradeep. Shika has not taken. Shika has done. Okay. Arshia hasn't done. Okay. Mitu, have you done? Do we know? We will discuss that questionnaire next time. Arshia, please make sure that you do that because I want that to be done before we have a discussion. So the way we handle conflicts will automatically come in this situation. If I'm in habit of acting aggressive, I'm likely to be aggressive with the patient. If I'm likely to be passive, then I'm likely to withdraw and keep quiet and just take it blindly. If I'm passive aggressive in my communication, then I'm likely to, act very quiet in front of the opposite party, but internally I'm disturbed and I'm going to talk poorly about the whole thing. I'm talking about the communication styles that we discussed last. But conflict resolution style is quite similar to this. And you have your scores with you. We will discuss this next time. And those who have not done, I request all of you. I think, Arshia, it's only you who are, or me too. Two of you haven't done, I think. Yeah. Okay. Now coming to the steps to manage and resolve complaints. So these steps I'm going to share as a presentation with you. And I want each one of you to make sure that you train your staff members to follow these guidelines. That will help them to see what needs to be done at one point, at each point, and how they can, de-escalate the situation. So let me share the steps to manage and resolve conflicts. Okay. The first step is where you pay them prompt attention and you verbally and non-verbally communicate that I'm happy to help you. That's where the whole, direction of your conversation gets decided. So, like for example, I said building a rapport. That's the first step where you make an effort to demonstrate that I'm willing to help you. I'm there to help you. So when you make eye contact, when you greet them, when you see tend to their physical comfort and you make them sit, they get to see that okay, there is somebody who is ready to listen to me. A lot of time we are sitting and the other person has come to us complaining, but we don't offer that person to sit. That means we don't want you to take my time. I don't want to invest time in you. I want you to be very short and brief and then leave my room. When you don't offer a seat, that's what is the non-verbal communication to your patient. Then it's important to offer them a safe place to express. A lot of time they start speaking in front of others. So that's going to complicate the situation. If they have a complaint or a request, and if you think it's something that requires attention, it's better to segregate them from the crowd. Make them sit at a separate place. Then again, that also will demonstrate that there is somebody who is ready to address my concern. And of course, when they are talking about their problem, it's important to show that, yes, I'm listening to you. It's very important to identify yourself and your role and how you're going to help them. So, right in the beginning, identify yourself that I'm so and so, I'm administrative officer, I'm nursing in charge, I'm doctor on duty, I'm patient care coordinator, and I'm here to help you. I will listen to your problem or your complaint, and I'll do my best to see how I can resolve. So, you are introducing yourself, your position, and also what you're going to do. And then once you have done that, when they start talking, it's important to acknowledge that they are visibly disturbed. And you will see people who come complaining. Usually they are very upset about it. When, if you acknowledge their pain and their suffering and empathize with them, they will definitely feel comforted and they will open up with you. Then, of course, you should be able to anticipate what kind of questions are going to come or what kind of requests are going to come, and then assure them of the best possible. Step 3 is ask them to narrate their problem in their words. So if you heard me saying, I said, please tell me what exactly happened. When you say something like this, that's an opportunity they get to vent their emotion and also details of the incident. That also gives you an opportunity to see what is the pain point in there. Do you know what they did? They left him undressed and then went to get another shirt for him. How can they do like this? Can't say they see that the patient has to be left covered. Even first of all, they should have brought the clothing. See, now you can see that their concern is the patient was lying naked. So ask them to narrate in their words. That will give them an opportunity to vent their emotion. And then they are sharing their concern. Please practice attentive listening skills that we have discussed earlier also, where you listen to them attentively, you demonstrate that I'm listening to you. Don't do anything simultaneously. Make eye contact, nod whenever required. Don't interrupt them, allow them to complete. If there is something that you want to clarify or you want to explain, make note of it. And then after they have completed, then you can, start talking about it. Half this suffering gets diffused if you listen to them attentively. And when they are sharing their concern, at times we may not agree with them or we don't think what they are saying is correct. But please stay calm, don't interrupt, don't try to correct them. No, 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 that's impossible. Nobody can talk like this to you. What you're saying, what you're saying is wrong or not accurate. So don't try to correct them. Don't be in hurry to justify yourself. We are short of staff, or that staff is new, or that he's a new joining. So when you give the such justification, that's not going to help. That's rather going to aggravate the situation. And then don't answer just for the sake of speaking. When they're talking about the situation, try to see their perspective. Listen to their frustration, understand how they perceive the situation, and what do they want. Because that's where the solution lies. Step 5 is empathize and acknowledge their feelings. And one of the best way to empathize is acknowledge, normalize, generalize. When I say acknowledge, that means I can see you are very upset. So that means you are acknowledging that they are upset. Normalize, when you say it's normal to be upset when others are not able to understand your point of view. It's very normal to feel bad when people are not behaving as they are expected. And anyone in your place will be upset in such a situation. So you are generalizing. So that comforts the person that you are not overreacting. And I completely understand what you are expressing is very genuine, and anybody would behave in that manner. It's very important to be mindful of your demeanor and also observe their demeanor. So from their body language, from their verbal communication, from their non-verbal communication, you'll get to read a lot. So observe their demeanor, and from that you can get idea what they are thinking or feeling inside. At the same time, mind your demeanor. A lot of time when we don't make eye contact, or when we make eye contact, but that eye contact is of disapproval or anger or disagreement, that shows that I'm not agreeing with what you are saying. Or if our facial expressions are indicating that I'm irritated, I'm fed up with you, you are taking too much of time, all that is going to, worsen the communication. So make sure that your body language, posture, hand movement, everything is appropriate to this situation. Words that we speak in this situation has a huge role to play. Like I said, that medical superintendent said, "Mitti hai, chahe aaj karwa lo, chahe kal karwa lo." I think that one sentence was enough to damage the whole situation. So can you think of some words or some phrases that we say, but which is very dangerous to use in this situation? Can you think of something? I think you're overreacting. It's not a big deal. You must have misunderstood. I don't think they meant to, disrespect your father. See, we are short staff, or staff is overworked. Sometimes when they are overworked, they behave like this. And nobody has ever complained. You are the one who is complaining for small. So when you say it's not a big deal, or what can I do, that's not my problem, all these things are more damaging than doing it. So we have to be careful not to say something like this. Even our actions can aggravate the situation. So when you say something like, so what can I do? That's not my problem. Or you physically try to intimidate them, standing toe to toe and standing eye to eye. That's also not a desirable kind of a behavior coming from our side. The next point is apologize. Should we apologize? Should we apologize? Do we apologize? Do we easily apologize? We do not like to apologize. We think if I apologize, the responsibility will fall on my head. For example, MRI machine has gone wrong, has stopped functioning. So patient has suffered. So in such a situation, when we apologize, it is the apology for the inconvenience caused to the patient. So apology has two meanings. When you say I'm sorry, the first one is expression of compassion. So you are apologizing for what the person has gone through, or that this situation has happened. Whereas the second apology is for the expression of responsibility. For example, if actually something has been done wrong by you or by your staff, then we have to take responsibility and we need to apologize. So the first one is always appropriate, whereas the second one is appropriate when it is true, then we have to say sorry. A lot of time we apologize, but the apology fails. Can you give some example how the apology fails? Can you think of some apologies that you have received, but they are not apology, they're more like verbal, just to uh, let go of this situation. If what you are saying is true, then I think I'm sorry. So that means I doubt if you are saying true. Apology will not work. There was a mistake, but in any case, the patient was not going to make it. I'm sorry, we can't attend to individual requests. So you are saying sorry, I can't be of any help to you. Sometimes these things happen. Again, that's not an apology. So when you apologize using these ways, it's actually not going to. So once you have heard them, once you have understood what they have gone through, and you have apologized, it's important to reassure a prompt action. So when you tell them, don't worry, let me see how I can help you. Give me 10 minutes, let me listen to my staff and understand what exactly happens. I promise we will take an appropriate action to satisfy you. Make all efforts to reduce their suffering and minimize the damage to the patient. And do not lose sight of the patient's health. So when the family insists that we want to move the patient from here, and if you insist, I will not force you to stay here, but right now the patient requires this care or attention. I would suggest that let's look after the patient for now, and then you can take a decision wherever you are. So what you are doing, you are kind of bringing their focus to the patient's life. Next is now explore alternatives. So when you start exploring alternatives, rather than offering a solution, ask them, what do they want? Tell me, how can I, undo this situation? What do you want? A lot of time, what they ask for is something that is easily doable, rather than going here and there and seeing what I can offer this person. Ask what do they want. When you ask them what do you want, you also get idea about what they are looking for, and then of course sincerely try to resolve the issue and address their concern by finding the workable solution. So focus on the solution rather than their behavior. A lot of times they are very aggressive or rude or misbehave. Put that aside. Just focus on situation and resolving it. And then when you are exploring alternatives, explore with an open mind. Because just offering anything that comes to your mind is not going to be enough. So you really need to very creatively find a solution that works for the patient and for the patient party. So I want you to do this activity in your notebook. Draw these 9 dots in your copy. Shall I stop sharing for a minute? Okay. So draw those 9 dots in your notebook and connect these 9 dots with 4 straight lines without lifting your pen. Have you done this earlier? Those who have done, they are not participating. It is for those who are doing it for the first time.
No.
So you try your hands, please. Draw those 9 dots.
4 straight lines.
Yes. Connect these 9 dots with 4 straight lines without lifting your pen.
4 straight lines.
Could anybody do? Chika, if you have done it, you can show, because if you have done it, then
We have to connect all the 9 dots.
you have to connect all 9 dots.
We can read right down the same line.
You can do it, but then show me how you have done it. Maybe it works for you. The total number of lines have to be 4, only 4. And you can't lift your pen. It has to be continuous.
Mhm. I did, ma'am.
Let's see. आप इसकी फोटो
Four
खींच के
split
ग्रुप में डालो डॉक्टर प्रदीप फोटो खींच के ना व्हाट्सएप ग्रुप में डालो
Okay.
अरे पेन नहीं उठाना ना you don't have to lift the pen it has to be continuous
Okay. Yes.
शिखा 5 लाइन हो गई ना ये तो 4 कहाँ है these are 5 lines okay let me show you
Okay.
so the whole idea is that you need to go out of the box to find solutions so when you are exploring options you have to think creatively and go out of the box to find solutions. There's another way. And will you believe that these 9 dots can be connected using 3 lines?
That was the easiest one.
According to a study by Harvard, there are minimum 4 solutions to a problem. And every solution should be tried at least 4 times before you give up. So that means there are 16 opportunities to resolve a problem.
Ram, these are not joining the lines, no, they're only crossing them.
I never said you have to join the line. It has to be continuous. You can't lift the pen. I said 4 straight lines without lifting your pen. So the whole idea is that we have to explore alternatives. The concept that I wanted to show was you have to be creative in finding solutions. You have to, continuously keep finding new ways to handle a situation. So when you are exploring alternatives, do it with a very open mind because you have to keep the larger interest in mind. The first incident that I shared with you when we started the discussion about their journalist, I think if the doctor had sensed that this patient part is aggressive and can, misbehave or become resentful and can go to the extent of harming me, you would not have done anything like that. So we have to keep the larger interest in mind. We have to be mindful of the consequences. And you must have seen a lot of time trivial issues turn into a serious situations. Then of course, when you negotiate with the family, You have to negotiate confidently. Also, there will be things that you cannot do. So you will have to clearly communicate what is not doing. Because not that under pressure you agree, okay, I waive off your bill, I terminate my staff, I give you a written apology, then that person is going to say, give me lifetime medical free treatment also. Because that, you can't get into that kind of bargaining or blackmailing. So if there is something that is not in your authority, you can politely say that I can't do this, but I can escalate your concern to the higher authorities for appropriate action. And do it in a very responsible manner, not like corrupting the other person's mind and putting the complaint in a bad light. Genuinely forward their concern and see what best can be done for them. So that's how you find a solution and you try to kind of execute the solution. When you are negotiating with them, it's very important to be mindful of how you are feeling in the situation. Because a lot of time we ignore our feelings and then it comes out as a very aggressive reaction to the situation. So you need to be mindful of your feelings. If you're feeling overwhelmed, don't ignore your feelings. Know your hot buttons. If you think something can trigger you in a situation and you may overreact, it is better to let someone else handle it, because they will handle with a fresh mind, with fresh emotions. So they will be more composed and more ready to handle it. And then remember the stop loss button. What is stop loss button? Any idea? So those who are into trading, they will know this button, stop loss button. So stop loss button comes from investment, where you buy some shares and then you decide the cutoff line, that if the price of the share goes down to this line, so you tell your investor that please dispose of these shares without asking me. Don't wait for my instruction. For example, I bought something for 100 rupees and I set a stop loss button at 90, and I tell my investor that in case if the price of the share goes down as low as 90, don't check with me, please dispose of. So that is like stop loss button. Similarly, when you are into a situation like this, remember that you can't afford to lose beyond a point. So we have to wisely, reflect on how do I handle this, or take some help, ask people to, contribute or discuss. Because you sometimes, when we get into the ego flight, we can go on and lose a lot in that part. So once everything is over, once we have decided something, once we have exited, it is important to document. So make sure that you write your details, then the background situation, how the patient party defined the problem, how you responded, what options were discussed, what you promised or you both agreed to do. Any suggestion about this situation? Like you think if this is something that's happening very often, then what do you suggest? And then, like for example, CAPA or RCA, whatever you want to recommend in that, you can suggest in that. And then make sure that you write your contact details, because how you can be reached in case if somebody wants to know more about the situation. After every situation, it's important to sit and reflect. The more we reflect, more we get to realize how to go about handle that situation. So sit back to check in how you felt, how you went through, how you handle the situation. Discuss with other team members, because you can learn from how they handle their situation. Read relevant material to update yourself and work on upskilling your team and yourself. So handling adversity is not easy, but then definitely it's something that can be learned. So for example, people who fly planes, they learn how to fly planes. People who work in submarines, they learn how to work in submarines. So everything can be learned. The same way, we need to upskill and learn how to handle difficulties. So just to summarize, make sure that you attend to your person properly. Also, communicate the process, identify your role in the process, ask their concern and genuinely try to understand. Acknowledge and listen to their complaints calmly, express empathy, apologize, reassure of prompt action, explore alternatives with an open mind, and execute, document, and review. Thank you. Okay, so this is how do you go about handling complaints, requests, or any situation which requires your serious attention and action from your side. What questions you have about the discussion we had? Although I know we had a lot of question answer during the session, but any more questions or comments?
I had one. So, I mean, would conflict resolution come in as a organizational kind of culture, right? Because, or does it start with, like you're saying, now that you're training us, like if we are the ones who are going with a proactive mindset, is that enough? Like, how do you get everybody involved into actually wanting to brainstorm about how to resolve conflicts? Because I think even in the stop loss button, if you are to make a decision for somebody to kind of like deal with the consequences in a particular way, it should be an agreed upon, right? If not, somebody might agree saying, we'll waive off the bill, and the institution will get into a big.
So I think it's important to, first of all, clearly know how you want to handle it, because your own conflict resolution style, first of all, you need to know. If you're in habit of avoiding, that means you're not going to resolve, you're just going to run away from the situation. So we have to be mindful of how I handle. And we all have discussed at length that it's important to address it, it's important to handle it, and we have to learn to handle. So if I know my style of handling conflict is aggressive or competitive or non-cooperative, that means I need to work on my conflict resolution style also. Then I need to work on my communication style. So not all decisions need to be endorsed and rectified by management, because of course, if you take a big decision like waiving off somebody's bill, or maybe sending the patient to another hospital, maybe you can't do on your own. For that, you require your seniors and your higher ups, support. But lot of situations individually at our level we can handle. When we start addressing the concern and seeing how we can resolve those concerns, that not only builds your confidence, it builds patients' confidence, it builds your staff confidence in you, that you handle such situations more sensibly than others. You just don't go and react to anything, but you resolve it in an amicable manner. So slowly your management also will start having confidence in your ability to handle adversities. And you must have seen there are always some people in an institution. Whenever there's a crisis situation, we call them. Arey, unko bulao. We need, because we know they in this situation also they will not lose their composure. They will still have their sensibility, and they'll be able to find some solution to the problem. Families में भी तो यही होता है ना, relationship में भी तो यही होता है. Families में whenever there's a crisis we call somebody जो हमें थोड़े wise लगते हैं. So create that position for yourself by acting wise in the situations that you are handling. And slowly then you will have more say in the system. Then what decisions you take will be liked and endorsed by others. But much more than that, I think individually at our personal level, if we learn how to handle conflicts and how to handle complaints and requests, automatically you will feel empowered and more in a stronger position. Very good question. I think that's a very interesting question. Thank you, Rishabh. Yeah. Any more questions or points you need to clarify? See, the approach has to be problem solving. Please remember. If your approach is problem solving, you will find a solution. Check what is your approach. That's very important. So if there are no more questions, I think we have presentation by Dr. Pradeep on storytelling. So Pradeep, Dr. Pradeep, are you ready? I'll share, I'll allow you to share your screen. So if you
Yes.
want, you can. And I'll be sharing the feedback form after this. You're requested to give feedback for the session, not Dr. Pradeep's presentation. Yeah. Go ahead, sir, please.
Thanks, ma'am, for giving me this opportunity to present storytelling. So my topic is storytelling. From childhood, we have raised by our mother, teacher, family members, part of who we are. It means skills and in like in Ramayana and Mahabharata, we have been told stories. Children usually they are the children who enjoys listening and telling the stories. They can make predictions about what will happen next, hence enhancing on their thinking and imaginative ability. Advantages are active parties mainly in the children age group, and it increases efficiency, and it increases willingness to communicate thoughts and feelings. It encourages use of imagination and creativity and cooperation among them. It enhances the listening skills, and it also helps children to develop non-tangible emotional skills such as empathy, compassion, and prospective talking.
I think Dr. Pradeep has got exited. So who is presenting next week? Please remember, we are left with only 3 weeks now. This is second 7, and we are just left
I'm going
with
to present, ma'am.
Shikha and Arshia. Both of you will present.
So then I'll present next week after.
Both of you then present, because I think we have 2 more presentations, no?
Mine's on the 31st. And
Yeah. Yeah. We can have you and me too also. 2 of you can now maybe we will have to have two presentations. Yeah. Should they check with Dr. Pradeep? Because he's not. I think he didn't realize that he has exited. And he says, I was continuously talking. Mm. I hope he rejoins.
I think when you put it on Canva mode, you're not able to see maybe the other part.
So meanwhile, I'll share the feedback form, है ना? At least वो काम हो जाएगा तब तक if he joins back.
So, ma'am, I have a question. For the presentation, we have to literally use that topic for presentation. For example, for storytelling, Dr. Pradeep shared.
YouTube Premium is ad-free YouTube and video
Are you ready?
downloads. So you can watch cooking shows as you eat.
What was that?
Something started in the background. Oh, were you able to listen to that? Hear that YouTube?
Yeah.
Okay, because there was this YouTube music. I had some, I mean, instrumental music was playing for a very long time. You were able to listen to that also. Oh,
We could
that's
just listen to the
surprising.
last one line.
Well, that's surprising that you only listened to that, because that continuously in the meeting there was this YouTube music that was playing. Then suddenly this one started. Okay.
Dr. Pradeep is there, but then Dr. Pradeep, please have your camera on.
There was some issue. I shared just a minute. I started with sharing the whole session as at the time.
We heard up to advantages of a
We'll
story.
try again.
Please try again. Yeah.
Okay.
So story आप पहले बताएंगे या बाद में, Dr. Pradeep?
I will start with the story. I think by the time I think these things will get settled. Typically. So I'm presenting a story of an army brave man who came for vacation and during Diwali time, Diwali celebration, and during his during Diwali, we used to exchange the gifts, and when he was going to exchange the gifts to his friend in DTC bus, and then one incident occurred with him. Some pickpocketer tried to snatch the valuables, and as he was a army man, he resisted that and fought with him. During that fight, that pickpocketer stabbed him badly and ran away. Then he stepped down from the bus and he found an dog clinic in front of him. And he shouted for help. And then no one came for his help from that clinic. Rather, doctor and his employee, they pulled the shutter down and refused to give him any help. Luckily, there was someone in the crowd who pulled the stretcher from that place and put him over that stretcher and took him to nearby hospital, which was hardly 300 to 400 meters away. Then in the emergency, doctors, sisters, everyone tried their best to revive him or to give him the best treatment, but they couldn't revive him. Ultimately, they have declared him dead. The story didn't end here. Actually, they start after this. Now, his wife filed an FIR and lodged and complaint with court. What went wrong? My husband came for vacation. What was his fault? That he had been stabbed in the bus, or he didn't get any medical attention. So he filed a normal complaint. Then during the court proceedings, uh, court has asked all concerned officer and even doctor, and what the other told the court, what he had in the explanation. He is a pediatrician, so he can look after only children up to the age of 16 years, though he can't handle the adults. The second explanation he gave, he didn't charge even a single penny from him. So there is a no doctor-patient relationship came into existence. So he's not liable for what has happened with him. But the court didn't uh, didn't agree with his explanation, and they put a heavy penalty on him. So the doctor reappealed again, and ultimately this case went up to the Supreme Court of India. And then the historic verdict on first aid of emergency patients came. It was Paramanand Kataria versus Union of India, 1989 case, in which court gave the verdict that every doctor or otherwise has the professional obligation to extend his services with due expertise for protecting life. The obligation has to be absolute, total, and paramount. There has to be no if and buts that I'm a pediatrician, I'm a gynecologist, I'm so and so. And last, to conclude this story, every doctor, healthcare worker is competent to accept and manage the emergency patients and at least provide first aid. At least that doctor can give him first aid. And this duty of care comes to an end only after either the patient gets stabilized or you have transferred that patient to some other center or patient dies. Thank you.
So, Dr. Pradeep, after the storytelling advantages, there were, I think, couple of more slides. If you can show those slides.
I will try, ma'am. Just
If it works, yeah. Otherwise, we can stop sharing. Yeah.
no, it's yeah, it has come here.
Yeah.
So this is our extensive use of the produce passive listeners, less participation. Uh, Listeners may not be able to question much, hence won't understand the lesson better. And do's in storytelling, make it relevant, be constant, tell a true story, relive a story as it has happened with you, and be neutral. There has to be no comment on the caste, religion, etc. Then don't ramble, don't tell two stories in one go, don't get too
Have I lost the voice, or actually there is no voice?
There is
Are
no.
you-
There's some
there is
network
no voice,
issue.
yeah. So I think, Dr. Pradeep, at your end, there is some network issue. So storytelling is a very powerful way to communicate a message. I think we are so used to storytelling because it generates curiosity, and you become suddenly very attentive, and you pay attention. So this can be used at any stage of program. It can be in the beginning, it can be in the middle, it could be even used as a conclusion tool where you conclude your message or a session by telling a story. So usually the story should have some message or some inspiration for the audience. It should relate to the topic, because if I'm talking about leadership, then it has to be a story about leadership. If I'm talking about assertive communication, then the story has to be about assertive communication. And now people are taking proper training to use storytelling as a way to do a session. But I think we are all using anecdotes and incidents and stories to make a point. I'm sure you must be observing I use a lot of cases and incidents to generate interest and curiosity, and also make the point that I wish to.
I'm sorry, ma'am. There was some network issues.
Yeah, I could see. No problem. I understand. Yeah. Yeah. So thank you so much, Dr. Pradeep. It was a good effort made from you. Please share the presentation in the WhatsApp group so that everybody can have a look at the slides. Even
Sure, ma'am, sure.
Maheshwari, I don't know if she's there. Maheshwari, I request you to, no, she's not there. I'll ask her also to share her presentation in the group. So all of you are requested to share your presentation after you have presented in the group. So meanwhile, I've shared the feedback form with you. Check how many of you have completed. I think who is still left?
I will
Anybody?
do just
Okay,
mine, ma'am. I will do.
no problem. I'll share in the WhatsApp group if you want.
Yes.
Yeah, you can do it in the WhatsApp group. Let me copy and paste it in the group. Yeah. Yeah, I've shared the feedback form in the group, so you can complete your feedback here. So I'll not hold you further. I think we'll close the session here. It's already 15 minutes past 10. Let's meet next Wednesday and continue the discussion about another interesting topic. Thank you so much. Good night. Bye-bye.